Hello, everybody. Welcome back to our series of podcasts that we call Menninger Mindscape. I'm Dr. John Oldham, Chief of Staff at Menninger, and my guest today is Dr. Jane Mahoney. Jane, welcome.
Thank you.
Dr. Mahoney is our Director of Nursing Practice and Research and one of our nursing leaders, and we thought it would be really nice to hear a little bit about a wonderful nursing staff with lots of activities, both in direct patient care but also education and research. And Jane's one of the central players in those areas. Talk to us a little bit about what goes on.
Well, thank you so much for this opportunity.
Sure.
Nothing I'd rather talk about than nursing at Menninger Clinic, because I'm so proud of what we've created here, of our extraordinary staff of nurses. We have so many that have advanced degrees. We are also an American Nurses Credentialing Center designated Pathway to Excellence facility. We were the first freestanding psychiatric hospital in the world to receive that designation, and we have been redesignated twice and will continue along that journey.
Which is terrific, and I understand there's a recent award that has been received as well.
Yes. Thank you. The American Psychiatric Nurses Association just recently awarded me the Excellence in Research Award for 2015, so it was quite an honor.
Well, congratulations, and that's great for you, but also for all of Menninger.
Well, that's the way I saw it when I received it, that I was representing Menninger, because the support that administration gives to nursing here and to all of us to be successful in our endeavors as we continue to develop ourselves professionally.
Right.
Yeah.
And you know, one of the unusual things is what we said earlier, that nurses here get an opportunity not just to do the clinical care, which is wonderful and essential,
yes,
but to take part in education and in research and training. Dr. Mahoney is associate professor in the Department of Psychiatry at Baylor and has been very active in your own career in terms of research.
Yes.
And you really have stimulated a lot. I know there's an annual poster session that the nurses put on. I've gone and looked and walked the poster halls and been so impressed with what everybody is very actively just considering part of their opportunity and what they do.
That's so nice of you to say and great to hear. We really have stimulated a lot of interest, and it's unusual for a freestanding psychiatric hospital to have this level of involvement in quality, in using improvement science and applying evidence-based practices to improve their practice. We began this program in 2006. With a lot of emphasis on evidence-based practice. We began by developing what we called evidence-based practice scholars, and every group has presented their project to the Menninger community, and many of those projects have been presented at regional and national conferences. Mm-hmm. In fact, most recently, one project was presented at the American Psychiatric Nurses Association, and the quality of it was so high that 2 editors from 2 different journals invited a paper off of that poster.
Terrific.
Yeah.
That's terrific.
So, you know, it's quite a thrill to see that happen for our young nurses, and so we'll be working on that very soon.
And nursing students come here to train from all kinds of places, is that right?
Yes, so of course Houston is a very large city and there are a lot of schools of nursing, so there's a lot of competition to be able to place their students here for psychiatric nursing training. So we have about 150 student nurses that come each year.
That's a big number.
It's a very big number, and the staff is so welcoming, and the student evaluations when they leave us they sing so many praises about their experience and how unique it was, because they finally were able to observe nurses actually spending a great deal of time developing relationships with their patients and teaching them coping skills and keeping them safe and working through safety plans. This is something they didn't experience at any of the other local hospitals. So that has led a number of those students to apply for our nurse residency program that we have. And
so say a little bit about that.
Yes. So we are lucky to have funding from the Betty Ann Stedman, the Stedman West Foundation, that sponsors our nurse residency program, and we bring in a small group of recent graduates and give them a 6-month preceptored training experience where we transition them from the student role to the professional role in psychiatric nursing.
And that's probably not terribly common in other places around.
It's becoming more and more popular, but I keep up with what the rest of the country is doing, and this is the only program of its type. We don't bring them in as staff nurses and expect them to start functioning. That doesn't happen for 6 months, and we gradually build up their skill set so that they're competent and confident in being able to manage a full patient load at the end of 6 months.
Well, and you know, that's very, very good to hear, and also works so well in this setting. So
Yes.
the nature of the work we do is so team-based
Yes.
that every member of the team is critical and valuable.
That's right.
So just say a little bit about how that works in the nursing role as a critical part of the team.
Well, as I think about onboarding new nurses, that's one of the first things that we immerse them in is the life of being a team member, because in this work, the work is so complex that we've got to have people with different knowledge bases to look at the same problem from different perspectives. If I tell the residents, if we or I tell all of the nurses, if we only needed one perspective, then everyone else could go home.
Mm-hmm.
We really need the knowledge from the different disciplinary perspectives to address the complexity of what we're looking at. And for the nurses, what their unique contribution is to that team is the holistic approach that is central to our practice. So it's not just looking at safety issues or what just happened, but rather really being able to construct a case formulation that's based on the biological, the psychological, the social and spiritual health needs of that patient, and bringing the big kind of broad pieces of what's happening with the patient forward so that others who will have a very focused perspective on certain dimensions can build on that, is one way to think about it, or at least the holistic view complements the work of the others.
Well, and you used the word relationship
Yes.
a while ago, and so
Yes.
that's really a critical part of what nursing does, but also is really special for nursing, because nursing
That's right.
staff are 24/7
That's right.
working with the patients,
That's right.
and that requires development of a relationship and bringing the learning and education and needs of the patient to the team.
That's right. The nurses really, of course, the relationship is critical for anybody that's caring for our patients. But for the 24/7, there has to be a different level of trust, a different type of trust that I can live, as a patient, I can live my everyday life in front of these people who are observing me all the time, and I can do it with some ease because I don't believe that they're really doing anything but trying to support me in helping me to make better decisions throughout my day, to teach me as they observe me becoming anxious, how to help modify that, how to reduce that level of anxiety to a more tolerable level, how to help me sort out my problems, how to prioritize and how to problem solve, even the way that I interact with my peers. You know, I'm speaking as if I'm a patient. And so a lot of socialization goes on the unit, and the nurses and the nursing staff are intimately involved in stimulating the socialization, role modeling the socialization, teaching social skills, and doing it in the most naturalistic environment possible, because we're trying to replicate what happens in the patient's everyday lives that we can intervene right then and there. So it doesn't matter what time of day these things happen.
Well, you know, there are testimonies that support the real value of that. We get follow-up, just sometimes out of the blue, letters of appreciation from either family members or people who were here as patients. And so often they singled out one or two of the nursing staff who were so important to them that they want to express their gratitude. I just came from a conference in New York where one of the people there had a son she said, whose life was saved by being here at Menninger. And she wanted me particularly to say hello to the nurse who was so important to her son as one of the critical people that she is eternally grateful. It's one case, but there have been many like that.
That's so rewarding to hear.
It is,
Yeah.
it is, and it's the kind of thing that we hope it's true for all of our staff,
That's
but
right.
certainly that is critical for nursing. Well, we never have enough time on these brief interviews and podcasts, but I think it's been great to hear a little bit about the many facets of nursing here, and it's a rich and rewarding experience because of that, as well as the opportunity to work with patients, not just for a few days,
That's right.
but over enough time, and that's hard work.
Yes. It's
Well,
heavy emotional lifting.
It is.
It
That's a good
is.
way to put it.
Yes.
That's a good way to put it.
Yes.
Well, thanks for joining us,
Thank
Jane.
you for the
And,
opportunity.
really
I appreciate it.
wonderful to hear about the nursing work and contributions to Menninger.
Thank you so much.
And thank you all for joining us again, and we'll see you next time.